Hello, my dear FMG friends. How are you all? Now your exam is over and you all must be having butterflies in your mind, in your heart, that what questions we had attempted, whether they were right or wrong. So here we are to discuss answers for PSM recall questions. As I again say that these are the recall questions. So we had framed the questions as per the feedback, what we had received from all of you. We had tried to put the choices, what again you had told us. So there could be some controversy in the exact language of the question, might be controversy about the choices. So I request you all to give me feedback by writing in the comment box if you want any addition or deletion from any of the question, either from the question frame or from the choices. Okay, so whatever has been done, but we cannot change it. So there is no need to feel little bit low if any of us is a feeling ki I had made the mistake in this question, I had made the mistake in this question. You might have made the mistake in few of the questions, but rest of the questions you must have attempted quite well. And as the question paper, if I say for the first section, first paper was quite good, all of you were happy, while second paper was little bit, I can say, the tricky clinical based questions were there, and in some of the questions you might be having confusion, no problem. But I'm very sure that you had attempted enough number of the questions correctly that is required to clear this exam. Okay, so don't worry. Now, coming to the PSM recall questions, if I say about PSM, I could collect around 31 questions from my students. And I'm very thankful to those students who had helped me in framing out these questions and their choices. Out of these 31 questions, if I say, only the one question was untouched question, like an oxidation pond. Rest of the questions were the same questions what we had discussed in our classes, or from those areas what we had usually taught in the classes. Okay, so hand washing in COVID is which level of prevention? No doubt about this, it is your primary level prevention, because COVID virus is there and we are doing repeatedly washing to avoid the entry of this virus and to cause the disease. So in the presence of the risk factor, we are trying to avoid the disease. It is primary level prevention. As cancer cases are increasing and having a relation with smoking, so government is trying to make anti-smoking policy. Now, friends, some of you were saying that government is trying to stop the factories which are manufacturing the cigarettes. If they are stopping the factories for manufacturing the cigarettes, it will be a primordial. But as many of you were saying that it was not stopping the factories, the government is trying to make anti-smoking policy, means they are trying that we should not smoke. So that goes in favor of primary level prevention. So there is a controversy. So as per the statement, I repeat again, if it is only the anti-smoking policy, I'll go with primary level prevention. If government is trying to stop the factories which are manufacturing cigarette or other tobacco products, then I'll go with primordial. But with this question, I'll go with primary level prevention. Very simple chocolate question. Copper-T 380A duration is none other than 10 years. Due to increase in cancer cervix cases, Pap smear was promoted for women more than 35 years, multiparous, with multiple sexual partners of low socioeconomic status. This type of the screening is. As we all know, there are varieties of the screening. When we are doing the screening in high risk individuals, which is supposed to be very cost effective, means with the minimal expenses, we are going to get more results, because these are all high risk factors for cancer cervix. So if we are doing the screening in this limited group of individual, then it is going in high risk strategy. Okay. Now, specific screening means if you are specifically doing a screening in an individual person, but here we are doing a screening in a group which are high risk for that particular disease. So this is your high risk strategy. 8-month baby had measles followed by diarrhea and dryness in eyes. Dose of vitamin A given today and tomorrow. Now, many of you had confusion since yesterday. I'm getting more than 100 messages that, ma'am, what is the correct answer for this? So here I am with the screenshot from our standard book Park from the page number 513 and clearly mentions that if there is deficiency of vitamin A, mind my words, in prevention, we are, or as a prophylactic, we are starting vitamin A from 9-month, completed 9-month onwards, okay? And between 9 to 12 months, we are giving 1 lakh international units. Beyond 12 months, we are giving 2 lakh international units, provided the baby weight is more than 8 kgs. But if more than 12 months and the baby weight is less than 8 kg, then still we are giving 1 lakh international units. And for prophylaxis, we are giving every 6 months. Okay. Now here, the specially mentioned in the this chapter that if there is the deficiency or there is symptoms of vitamin A deficiency, okay. So this is the age, if it is between 6 to 12 months, and we are giving 1 lakh international units. This is for deficiency, and we are giving the same dose on day 1, day 2, and sorry, just a minute. And we are giving same dose on day 1, day 2 and day 14. Day 1 means on the day of starting, some books they write day 0 also, on the day of the starting and on the next day, that is day 2. Okay, so in deficiency, we are giving this high loading dose on the day first day and the second day, and third dose we are giving after 14 days. Okay, it may be given between 14 to 28 days also. So here the correct answer for this is, as we are giving in a deficiency of the vitamin A. Why? Because we know that measles leading to diarrhea causing deficiency of the vitamin A, and as well as it is mentioned that there is dryness in the eyes. So this is also suggestive of the vitamin A deficiency, and as the baby weight is 8 months, so between the 6 to 12 month age group, so we are giving 1 lakh international units, 2 doses today and tomorrow. So no confusion in this question. 35-year-old man living with his wife and 3-year-old child. His wife is 6 months pregnant. His brother with his wife visits for 1 month in winter vacation, and during that time you visited for a survey. What is this type of the family? Again, there was lot of confusion in this. Now please listen carefully. Now, as this is the man with the wife and the children, so this is the nuclear family. Clear? Now his brother is only visiting in the winter vacation for 1 month. It is like a guest. It is not going to stay permanently there. Unfortunately, you had visited at the same time, but that brother is a guest. Okay, not staying, not contributing in the you can say the family expenses, or common purse is not there. Okay, so it will not be a joint family. Now the question is that whether they had asked the type of the family or they had asked family cycle, or you are very sure that it was asked the type of the family. Okay, so type of the family can be the nuclear family, means husband, wife and their children. Joint family means the husband with their blood relatives sharing the common purse, common business, common kitchen, and this joint family is having you can say the same common business, means the common earning, and they are contributing in that expenses. 3-generation family. 3-generation family means if a person is living with their parents and their children, this is 3-generation family. So this family, the type of the family is nuclear family. Now if I say in which family phase or this is family cycle this family is, it is now going in a second baby. So this is in the extension phase of a family cycle, but family cycle was not asked, so it is not an extended, although the joint family is also known as extended family. Okay, so here the correct answer, if they had asked, is what is the type of the family, it is nuclear family only. Very simple question. The per student area in class room, it is 10 square feet per person. Okay. Middle-aged man who is maize eater. Very commonly, very frequently asked question. And again, it is a repeat question. It's a maze eater presented with complaint of lethargy, dementia, and dermatitis. What vitamin deficiency? It is none other than the B3 or it is niacin deficiency, because they all are talking about the features of palagram. Not a micronutrient in diet, although we say that all the vitamins and the minerals are micronutrients, and the protein, fiber, fat and carbohydrates, they are the macronutrients of the diet because they are required in grams. Okay, but out of these given choices, if I say zinc, selenium and the iodine, it is required in micrograms, while calcium is required in milligrams only. So this is only mineral which is required in a very large amount in comparison to other. So I'll go with this. The calcium is not a micronutrient in diet. Very, very simple question. For safe strategy for trachoma, S stands for. S stands for it is the surgery. A stands for antibiotics. F is a facial cleanliness and E is environmental hygiene. So it is S stands for surgery. Here the image was given. If we see the image, it is the baby with having some running nose is there, some excessive secretions from the eyes, like a conjunctivitis is there, redness in the eyes, and rashes are present over the face. Okay, a small macular erythematous patch, these rashes are seen all over the face. It is also looking over the chest also, and they are very confident. So baby presented with history of fever, cough, conjunctivitis, running nose with the rash given in the image. So there is no confusion. This is a baby having measles infection. All are included in RCH program except, although now we can say that is RMNCH plus A, that is reproductive, a maternal, a neonate, and childhood plus adolescent, but still they had asked is a RCH program. Now we already know that we are following the 5x5 strategy in RMNCH plus A program, and that's why again I had taken a screenshot from our standard PARC textbook. And what are these 5 strategies are there? That we are focusing on reproductive health, where we are focusing on contraception, we are focusing on maternal health, trying to avoid the maternal mortality, giving the proper services, antenatal, postnatal. We are focusing on newborn health. We are focusing on child health. We are focusing on adolescent health. Okay, and in adolescent health, mainly our focus will be the giving them sex education and preventing or treating STDs. Okay, so coming to that, what they are asking, that all are included in RCH program except motherhood. Yes, it is a component of this. Sex education for adolescent. Yes, it is also a part of this. Treatment of STI or RTI. Yes, it is also a part of this. Women education and empowerment. It is not directly a part of RMNCH plus A or RCH program. So I'll go with the answer, that is women education and empowerment. A lady with 6 months pregnancy having 2-year-old baby, vaccine given. And as we all know that now we are not giving TT vaccine, it has been replaced by TD. So these 2 choices are out, that is TT. Now the second concept here was that if a next delivery is happening within 3 years of previous delivery, then we are giving only the single booster TD dose. If a next pregnancy is after 3 years of a previous baby, then we are giving 2 doses. So here only the 2-year-old previous baby, and now again she is pregnant, so only we are requiring single booster dose of TD. So this is the answer, that is TD boosted is given. Post exposure prophylaxis for grade 3 dog bite. Now here they had confused you that they are giving, the person is having grade 3 dog bite, clear, and we know that in a grade 3 dog bite we have to give the vaccine, immunoglobulin and local care both. But see the next content or next portion of this question, who had taken full anti-rabies prophylaxis, that is very, very important, 6 months back. Now again they had confused you that it has been taken after monkey bite, and now it is saying that it is a dog bite. So hardly matters, these all both are monkey and the dogs, they are considered as a wild animals and they can spread rabies. So if a person has taken the full vaccination after monkey bite 6 months back, so already that person is immunized. Now if within 3 months again bite happens, then nothing has to be given, but after 3 months if it has been there, so we have to give some prophylactic vaccination following the post exposure prophylaxis. Okay, so already who had received the vaccination, and now again re-exposure happens and we have to give some prophylactic vaccine in a smaller doses. Okay, so here only we are giving 2 doses after the this dog bite. So this is one point clear. So this is that 5 doses are out. We are not supposed to give the 5 doses because it is a post-exposure prophylaxis in already vaccinated individuals. Clear? We are not giving immunoglobulins because already the antibodies are present. Now the question is whether we are only giving the vaccine or it's a grade 3 bite. So we have to give the cleaning of the wound also. So obviously the cleaning of the wound and vaccine on 0 and 3 day. This will be the best answer in the given choices. In urban area of Delhi, if where 3,000 to 4,000 people of different religion are living, selection technique for studying dietary plan. Now we know that when we had the different groups, here the different groups are of different religion and we want to study them. So we have to divide these different individuals of the different religion in the different groups. So you are taking the different groups of the different religion and then we are doing simple random sampling from each of them. And this is called as stratified random sampling because we are classifying them in the different groups of the stratas. So this sampling technique is stratified random sampling. If you are simply randomly collecting, this will be a simple random. If we are collecting a sample interval, based on that we are collecting which number of the individual we have to select, that has become my systematic random sampling, and cluster random sampling is done for immunization survey. So here the correct answer is stratified random sampling. Very simple question. Baby with dry eye and xerophthalmia, obviously it is because of deficiency of vitamin A. History of vaccination was studied in 1300 kids with autism and 4400 kids without autism. Okay, so here they are trying to ask what type of study this is. So they had given one group with the disease and they are comparing this group without the disease or without the healthy individuals. So one group is where the autism is present, another group is where the autism is absent. Okay, and then they are taking the history of vaccination. They are going in a backward direction. They are taking history of vaccination and they found there is no association between autism and vaccination. As we know that odds ratio can be calculated by this study, and if you say if the odds ratio is 1, it means there is no correlation between the disease and the risk factor. Here the risk factor is supposed to be some vaccine which was given and they are trying to assess whether this vaccine was responsible for causing the autism or not, and they found that there is no relationship or no association. And as they are going backward from the outcome to the risk factor, this is none other than your case control study. Very simple question. Usually they were asking the MMR, but this time they had asked IMR. Maternal mortality rate is infant death per 1000 live births. Eligible couple, again very commonly asked question, very simple question. Eligible couple register is maintained by multipurpose worker female at subcenter, and we know that this is for promotion of contraception and who are eligible couple where age of female in reproductive age, that is 15 to 49 years. If you want to explain cleaning of wound following dog bite to community, preferred method. Earlier they used to commonly ask that how you are explaining to community to prepare ORS. Okay, and now they are asking that if you have to explain to the community that if any animal has given you bite, you have to do the thorough cleaning of that wound, and usually we say that it should be with the running water. It will not like you are taking in a glass, you are taking a water and just dropping drop by drop and taking 5-6 hours. No, it should be forceful with running water and you should be cleaning for minimum 15 minutes. Clear? So earlier they used to ask about the ORS preparation, and this time they had asked about how you are demonstrating them cleaning off the wound following dog bite. So this is none other than the demonstration. Okay, and here I just want to share one of the clinical story, which a true story in a pediatric unit. Pediatric OPD, the junior resident was sitting and mother came with her around 8-month baby and came with complaint of that, doctor, my baby is having a loose motion, around 6-7 loose motions since last 24 hours. So resident has just handed over the pouch of ORS to the mother and they say just give it to the baby कि बच्चे को दे देना, कोई बात नहीं. Next day mother came again and mother says डॉक्टर साहब कल से जब से मैंने उसको पाउडर दिया है बेबी के माउथ में जो है ना छाले हो गए हैं, बच्चा कुछ पी नहीं पा रहा है. Then doctor asked how you had given that. She said simply innocently that डॉक्टर साहब I had turned the pouch and मैंने पाउडर बच्चे के मुंह में डाल दिया. So, because resident doctor was so busy in the OPD that he was not having time to tell, and again he said, okay, now take another this pouch ORS sachet and just dissolve in water and give it to the child. Okay, mother left with that ORS sachet, and after 3-4 days again she came back and she said, doctor, still my child is having diarrhea. So doctor asked that how you had given this ORS. So she said that I had put that sachet in my 20-liter of water bucket in my home and I had put that sachet in that, and since that last 4-5 days whole of my family is drinking water from that bucket. So again, because she was not knowing how to just give the ORS sachet. So friends, always we have to tell them very clearly, like you have to boil 1 liter of water, just cool it, mix that 1 sachet in 1 liter of water and to be used within 24 hours. If it is not used, then you have to discard. So see how much is the value or the importance of giving proper demonstration. Okay, so that's why we say that learning by doing or learning by seeing is more important than simply reading or the story. Okay, so at least we have to just show them that how it has to be done. So this is the demonstration what we have to show them. Teeth are turning from white to brown due to increased content of, it is none other than the fluoride, and we know it's a dental fluorosis, and when the serum level of fluoride is between 1.5 to 3 ppm, then it is causing dental fluorosis. Again, here I just want to share another very important clinical point. In a OPD, around 15-year-old adolescent girl came, and girl came with menorrhagia. She was anemic, and obviously for treatment of anemia following menorrhagia, we have to give iron folic acid preparation. And there is a very we can say that confusing point whether you have to write tablet or capsule formulation and you write a syrup formulation, because it depends upon patient choice. So I asked that girl that in which form she would like to take the iron. She says, doctor, I want to take syrup. I said, okay. So I prescribed iron folic acid syrup, and the next day again she came in OPD and she was in little bit anger, and her mother was also in little bit anger, and they said that doctor, what medication you had given? My girl has all the teeth got black. And really, I had seen that all the teeth were black. Usually, iron syrup is causing the blackening of the teeth, but it is not with a single dose of 10 ml of iron syrup. Anyhow, we consulted our dentist, and ultimately, she turned out to be having dental fluorosis. So her teeth was very sensitive and they had taken stain very easily. So the cleaning of teeth was done and she was shifted on oral formulation, and then she was quite well. So what again I want to just give one practical message at this point is that if you are writing any prescription to the patient, and if anything developing after starting your medication, you are guilty for that. As per the patient, we can say, a patient के नजरिए से आप guilty हैं. So we should not immediately jump to say that no, this cannot happen with my medication. This I know that this cannot happen with this medication, but you should try to listen to patient very carefully, and then you have to justify. Then only they will be realizing, because that condition may be in a subclinical form, but it has aggravated after taking your medication. So you are at a fault. So we should be very careful in follow-up, and if anything happens abnormal, we should try to think double that whether this is a reaction or the side effect of our medication, or it was a exaggeration of existing condition that has given these symptoms. So we should be able to justify that. Clear? Okay. Now, duration of barrier contraceptives after vasectomy. Now, usually we say that minimum 3 months of barrier contraceptives we have to use, or at least 30 ejaculations are needed till that male partner is becoming sterile. Now, here they had not mentioned the 3 months. Although for confusion they had mentioned 3 weeks, that sometimes you might underestimate or underrate this week as month. So, it is not a 3-week duration. It is also not 3 to 4 weeks duration, and 8 to 12 weeks it is towards a lower side. So, we can use for a little bit longer but not to a lower side. So, I will go with 12 to 16 week duration. Most common indirect cause of obstetric death. Now, we know that direct cause of obstetric death is hemorrhage, but here they are asking indirect cause, and indirect cause is anemia, because preeclamptic toxemia, eclampsia is a direct obstetric cause. Puerperal sepsis is also a direct obstetric cause. Hemorrhage is also a direct obstetric cause. I cannot get a fourth choice, and if any one of you can recall, just write in comment box. So I will be updating these questions. So here I'll go with anemia, which is most common indirect cause of obstetric death, and that's why we all know that government has started Anemia Mukt Bharat or intensified iron plus initiative, where we are giving iron folic acid preparation as a prophylactically right from 6 months of the age onwards. Dietary supplementation covering 98% population is. Now, whatever food content or mineral or we can say macronutrients, whatever we are giving, either we can give as an average requirement. So, average requirement will be fulfilling the demand of only 50% of the individuals. So, estimated average requirement is not taken in nutrition. In nutrition, we are taking the recommended dietary allowance, that is also known as RDA, and it is covering mean plus 2 standard deviation, means it is covering the requirement of around 97.5% population, that is almost near to 98%. So, I will go with the recommended dietary allowance we are choosing. A factory worker presenting with symptoms of cough on X-ray chest, ground glass appearance diagnosis. Although you are studying this in great detail in your pathology classes, and here it is none other than asbestosis, because in silicosis we had snowstorm appearance and ground glass appearance is seen in asbestosis. And here we also know that most common pneumoconiosis, or the only pneumoconiosis which is causing lung malignancy, is asbestosis. Fecal-oral route of transmission seen in, although A and E both had a fecal-oral route of transmission, but fortunately they didn't mention E here. So, option left is only hepatitis A. The rest all three, they are having the hematogenic or sexual transmission is there. Crypt tuberculosis. Now, usually we call it as a latent tuberculosis, but here they had used the word crypt, means hidden. Hidden tuberculosis means the clinical symptoms are not there, but that person is having infection. So, if no clinical symptoms, the X-ray will be normal and tuberculin or the Montus test will be positive. So, X-ray is normal, but tuberculin test is positive, although the best will be the IGRA test. Propaganda is, again, it is clearly mentioned in our PARC the differences between the propaganda and education. Now, propaganda mein we are hydrogenically giving the knowledge in the mind of the people. Whatever we tell them, they understand, and we can mold them as per our choices. So, we are not giving them any extra knowledge, but whatever we want that they should take, it is a spoon feeding. We are not letting them to think anything extra. Their active involvement is not there. The passive spoon feeding is being done. So, knowledge is a spoon feed in those individuals. Okay. So, we are dealing with their emotions, and we are just putting the knowledge in the mind of the people. They are not actively participating. Okay. And there is no change in the attitude or behavior, while it is opposite in the education. So, coming to the points, what they are asking, what propaganda is, it is behavioral manipulation. No, it is not a behavioral manipulation. Acquired knowledge and skill. No, we are doing the spoon feeding, trying to make them like themselves. The students are asking, this was the exact statement given, trying to make them like themselves, means as what we want to make them behave them like us or like our desire. So this could be the best answer for this given a question, and I could not get the fourth choice. Oxidation pond. Yes, this was a new question this time. Usually we don't touch in the classes. So what is actually the oxidation pond? It is a method for sewage treatment, where what we do that in a pond like structure, which is around a 1 to 1.5 meter depth is there, and there is an inlet and outlet is there, and sorry, there is inlet and outlet is there, and sewage is collected here. So this sewage must be having algae and bacteria in that. This is a first requirement. There must be the algae and bacteria in that. So what happens in the daytime with the sunlight? Okay, so bacteria, they are getting the oxygen from the sewage also, from the sunlight also, and they are causing the oxidation of the organic material which is present in the sewage, and it is liberating carbon dioxide, and this carbon dioxide is again utilized by the algae in presence of the sunlight, and they are preparing their food, and again oxygen is liberated. So in the daytime, this is your oxidation process, aerobic oxidation, because it is requiring oxygen, and in the night it is anaerobic oxidation process happens. So this was the question asked in oxidation pond. It is aerobic in day, anaerobic in night, anaerobic in day or aerobic in night, both day or both night. So this is actually aerobic in day and anaerobic in night. Now here I was having some confusion getting the choices. The question was very simple. 6-month pregnant woman working in the industry who is normal at that particular point is applying for maternity leave for a duration of. Okay, so 6-month pregnant woman working in an industry, and we all know that maternity leave is given for 6 months or 26 weeks. Clear? Either she can take at any time in a single stretch also. She can take before delivery, extended after the delivery, or she can work till last day of her delivery, and she can take full leave post delivery also. But students were saying that there was an additional content given in that. It was not only at 26 weeks or 28 weeks. They were saying that 28 to 4 weeks, 26 to 6 weeks, or immediate 30 weeks. Okay, so there was some confusion in the choices. So just try to understand the concept, and if you had the correct choices, please again write in the comment box so I can update my question. So here the concept is that 26 weeks duration is the maternity leave, but in case this lady is 6 months pregnant, so at this time she is normal, but we can't say whether she will end up in a premature delivery or she will end up in an abortion even before completing the 7 months. So if it is an abortion leave, then abortion leave is given for 6 weeks. If it is the maternity leave, it is given for 26 weeks. And if she wants to leave for some any other sickness, it is 30-day leave is there. So as per the choices, what I had framed in a little bit different way, but as I am saying that these may not be the exact choices, so please let me know. So I'll go with the concept that 26 weeks postpartum leave, and if it is case it is an abortion, so it will be a 6 weeks post abortion leave. Okay, but as the choices may be different, but the concept is that maternity leave is 26 weeks, post abortion leave is for 6 weeks, and leave for any pregnancy related sickness, it is for 30 days or 4 weeks. Clear? After normal delivery, the breastfeeding is started within. Breastfeeding is started after normal delivery to be started within 1 hour, and if it is cesarean delivery, to be started within 4 hours. So friends, these were a few questions which I could collect. If you had any other extra question, again you can message me or you can write in this comment box. So wishing you all a good luck for your results, and may God bless you, may God shower happiness on you, and you should achieve success in life, and you should achieve whatever you want in your life. So friends, I can say that by the time your result is out, this is your golden period. This is your golden period. Whatever you want to do, you can do. You have to, or you should enjoy these days thoroughly, because once your result is out, you all are passing this exam, then you will be busy in your internship, might be preparing your PG entrance examination, then life will be changing. So these are the golden days. Enjoy fully. Wishing you all the very best.